Good afternoon. My name is Kendra White, and I'm Senior Manager of Community Relations for UPMC for Life. Today we are here for episode 7 of our Staying in Touch series, Taking Care of Each Other. The Staying in Touch series was designed with you in mind. UPMC Health Plan is here to help you stay connected and informed during this challenging time. We are so happy you've taken the time to join us today, and we see we have quite a few listeners with us. And you'll hear from some of our experts in the fields of preventive medicine, mental and physical health, and other specialties about how to stay healthy, manage stress, be active, and connect with your community, all from the comfort of your home. Our program will last today for about 30 to 45 minutes. And before I introduce our presenters, I want to start with a quick poll question for our audience of listeners. Now, for the polls, if you're joining us via phone, you will press 1 for yes or 2 for no on your telephone keypad. And if you're joining via the online platform, you'll see a new poll question that has become available, and you'll have the option to vote accordingly. So my first poll question today, I'd like to know, are you a caregiver for a friend, a family member, or a loved one? Press 1 for yes, press 2 for no. The question again, are you currently a caregiver for a friend, family member, or a loved one? Press 1 for yes, press 2 for no. And again, on the online forum, you can vote accordingly if you're logging in online. I'd also like our audience to know if at any time you'd like to ask a question, you can press star 3 on your telephone keypad to be connected to someone from our team who will take your question and share it with us. If you're joining via the online forum and you decide to type in a question there, please provide your name and an email address or phone number where we can get back to you right away, as that information is not provided automatically via that forum. Again, if you're connecting for questions, please leave your name and an email address or phone number so we can get back to you. If we don't get to answer your question on the live call today, we will be given a log of these questions after the call, and that will enable our team of professionals to follow up with your question, comment, or whatever your need is accordingly. If you have questions specific to the COVID-19 virus, we ask that you visit our website, www.upmchealthplan.com/COVID-19. So again, today, if you're joining via the phone, you can press star 3 for questions or comments. We also welcome any ideas that you may have for us that you'd like to see in future presentations. So you can also connect with our folks to, give us your comments there and or type them in on the online forum. These programs were created with you in mind, so we definitely welcome your feedback, and we will look to incorporate some of your ideas into our future presentations. So today is a very special topic, one that I work very closely with, and I have one of my colleagues joining me today for the presentation. Her name is Shannon Miller. Welcome, Shannon. Shannon is a program manager for our Resources for Life program, and she has been with the health plan since 2016. Her background is in social work and gerontology. And your other presenter today is yours truly, Kendra White. And I have been with UPMC Health Plan since 2005. My background and education is centered around public health and gerontology and marketing and community relations. So Shannon and I today are going to be discussing the caregiver issue that we, as caregivers, whether it's indirectly or directly, caregivers have a lot of health issues that need to be looked at in a special, particular way. So Shannon if you're ready to go, I'd like to welcome you today. Thank you for joining me for this discussion.
Thank you, Kendra. Welcome, everyone. We're so glad to have you on our episode for today. And what we'll do now, we're going to review our agenda for our Staying in Touch today, which, as Kendra mentioned, is taking care of each other. So our agenda today includes the following. We'll be discussing the caregiver role, signs and causes of stress, managing stress and preventing burnout, the importance of self-care, tips for keeping loved ones engaged, additional resources, and finally, any questions that you may have related to caregiving. And there are a number of key things to understand about caregiving, caregiver stress, and how stress affects caregivers. The way stress affects caregivers has always been recognized, but this is even more important now during this time of social isolation due to the COVID-19 pandemic. Surviving the caregiving experience is good, but thriving is actually a possibility for caregiving if given the necessary tools. Determining ways to handle your stress as a caregiver is vital to your health and well-being. And we'll discuss some ways to manage caregiver stress during this presentation and end with some additional resources and tips for keeping loved ones engaged during this time. So now we'll talk about the caregiving role. A caregiver can be a relative, partner, friend, or neighbor who helps with daily living activities. You may not readily identify yourself as a caregiver because it can be more than just helping someone with their medications. Recognizing how caregiving affects you is a critical step in determining ways that work best for you in order to take care of yourself. There are many ways to manage caregiver stress and burnout in order to assist with the role of caregiving during this time of social distancing, and we'll review those further in today's presentation. As I mentioned in the previous slide, you may not identify as a caregiver. However, there are so many everyday activities that caregivers assist with. So I'd like to discuss some of the different tasks that caregivers provide and see if you identify with any of these. Caregivers assist with buying groceries, cooking meals, cleaning, and many other things that are required to maintain a home. Caregivers perform medical interventions, arrange medical appointments, take their loved ones to these appointments, and assist with medical interventions. They also arrange medical appointments, as I had previously mentioned, and also monitoring of medications. They talk with doctors, nurses, and social workers to understand their needs as a role that caregivers provide. They coordinate care of their loved ones with many different professionals and also arrange for help if a crisis would arise. They also manage finances and other legal matters, and they also act as a companion. There are even many more responsibilities that caregivers provide to their loved one, so you might want to ask yourself, do any of these resonate with what I provide?
Thanks, Shannon. I wanted to mention one more thing. If you were joining us online, we had a little bit of a hiccup with the slides, so they should be visible now, and these will all be available on our website afterwards, which I'll mention at the end of our presentation, how you can see these slides again after we're done with our talk today. So the slide that I'm looking at now, signs of caregiver stress: feeling overwhelmed or worrying constantly, feeling tired often, sleeping too much or too little, gaining or losing weight, being easily irritated or angry, feeling sad, having frequent headaches or experiencing body pain or other physical problems, overusing alcohol or drugs, including prescription drugs. These are all signs of caregiver stress. How do you know if you're feeling stressed from your activities as a caregiver? The list I just mentioned provides some signs to look out for. If you're feeling tired or worn out all the time, you feel more sad than happy, Especially right now, during the time spent inside due to social distancing, you may experience these feelings even more. Also, keep in mind any physical health issues that you may be experiencing. If you ignore these signs, it can lead to more severe symptoms, and these symptoms can result in caregiver burnout. Caregiver burnout is a state of physical, emotional, and mental exhaustion. It can leave you feeling overwhelmed, irritable, and with a downright negative outlook. Some of these causes could include changing roles. You may have never expected to have to take care of your loved one or have to provide care 24/7. Having unrealistic expectations for the caregiver or for others. Loss of control. You may no longer have any access to help during social distancing, so it's out of your control now. Or even experiencing isolation. Having to maintain social distancing can be difficult, especially for caregivers, as they are now maybe the sole caregiver and can't rely on others to have them come in and help them with their caregiver roles. Some causes of stress. These factors may influence the degree of which the caregiving experience will or will not be stressful. Inheriting the caregiver role. Did you sign up for this task? When people inherit the caregiver role and feel that they don't have a choice, the chances increase that they will be more distressed and feel resentful. It's important to accept limitations and to forgive yourself for your imperfections. There's no such thing as a perfect caregiver, especially during social distancing when you may have increased responsibility as the sole caregiver. Strained relationship with the care receiver. If this relationship has been problematic in the past, chances are caregiving will present some challenges. Sometimes people hope to heal a relationship while caregiving, but it's important to consider what your relationship with your loved one was like prior to caregiving. The caregiving situation, what does that require for you? Are you now a 24-hour-a-day caregiver or occasional phone check-in on someone who you're providing indirect care for? If the illness is chronic and progressive, such as Alzheimer's, dementia, cancer, there's a greater likelihood that stress can increase. Those that have come into your home in the past to help may not be able to do so now due to COVID-19, so your caregiving situation may solely rely on you, and you may be experiencing feelings of loss of control due to this. Also, looking at your support system. Can you identify your support system? Are you in isolation right now? Do you have the support that you need? Have you considered joining an online, telephonic, or virtual support group to stay connected, or even telephonic counseling? Some coping strategies. Learning how to identify your current coping strengths and weaknesses is essential to thriving while caregiving. How did you cope with stressful situations before isolation? Just remember to take time for yourself and to practice self-care. Next, we'll discuss managing stress and preventing burnout. I do want to remind our listeners, if you have a question or a comment for us, you can press *3 on your telephone keypad to be connected with someone who will take your question for us. And if you're joining us on the online forum, you can type your question in the box there. Just please provide us with your name and a phone number or email address where we can get back to you if we do not get to answer your question today on our call. So back to managing stress and preventing burnout. It's important to recognize the warning signs. It is possible to thrive during the caregiver experience. However, step 1 is to recognize the warning signs that you may be experiencing increased stress. We're all a little overstressed right now, right? But it's important to ask yourself, what are my warning signs that I'm feeling overstressed? Caregivers may often lose interest in activities that they once enjoyed doing. That could be one of your warning signs. I'm just not enjoying what I'm doing anymore. Next, Identify some of your sources of stress so that you can do something about them. Take a second and ask yourself, what are my 2 sources of stress? Write them down. Then, can I change anything about these stressors, the 2 that you just wrote down? Look at those stressors. If so, what can I change? The key is to focus on what you can change. Then ask yourself, what actions can I take to reduce or manage stress? Identifying what you can and cannot change or control. One thing you can control is your perception of a situation. In some situations, our attitude may be the only thing that is within our control. Attitude is the way that you mentally look at things. In other words, it's whether we see the glass half empty or half full. And the final point of this slide is to take action to manage your stress. You have to find activities that are most effective for you. Stress-relieving activities are unique, not one size fits all. What works for one person may not work for the other. There are many different tools for managing stress. These can include deep breathing, meditating, yoga, going for a walk, digging in your garden, calling an old friend, even cleaning the house. Again, what works for one may not work for another. So you want to think to yourself, what are some current stress management techniques that I've used in the past or that I currently use? And it's okay to write these things down as a way to really make a contract with yourself that it's important to take care of yourself while caregiving. So now we're actually going to take a few minutes and listen to an audio file. We're going to practice using breathing. This short, almost 4-minute exercise will walk us through taking time to remember to breathe. So I want you to take a second and make sure you're seated and comfortable and listen to this breathing exercise that we are going to play for you at this time.
Start by finding a comfortable position. Sitting or laying down is totally fine for this. Once you're there, gently close your eyes, and let yourself settle into silence for a moment. For this practice, you'll do a few cycles of inhaling, holding your breath, and then exhaling. If you can't hold your breath the whole time, just hold it as long as you can, and then wait at the bottom of your exhale for the next cycle to begin. Start by first exhaling all your breath out through your mouth. For this practice, you should be able to hear your exhale every time. Now, close your mouth and inhale quietly through your nose, counting silently to yourself, 4, 3, 2, 1. And now hold your breath here for a count of 7, 6, 5, 4, 3, 2, and 1. And now exhale completely through your mouth, making a whoosh sound to a count of 8, 7, 6, 5, 4, 3, 2, 1. Great, that was one breath. Now inhale again and repeat the cycle 3 more times for a total of 4 breaths. And second cycle, inhale 4, 3, 2, 1. Hold for 7, 6, 5, 4, 3, 2, and 1. And exhale 8, 7, 6, 5, 4, 3, 2, 1. Starting again. Inhale 4, 3, 2, 1. Hold 7, 6, 5, 4, 3, 1. Exhale, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, last cycle. Inhale, 4, 3, 2, 1. And hold, 7, 6, 5, 4, 3, 2, and 1. And exhale, 8, 7, 6, 5, 4, 3, 2, and 1. Now take a moment here to breathe normally. Feel how your body has relaxed. Notice if your mind has quieted at all. Just rest here, keeping your eyes closed.
Well, that was wonderful. Hopefully everyone had a chance to really sit back and relax and enjoy that breathing exercise. So you see, a caregiver's life can be more fulfilling when stress is managed. Here are a few more suggestions that caregivers can take when feeling stressed and isolated during times of social distancing. Reach out to family and friends often. With social distancing, it's important to remain connected, even to ensure that you're not feeling isolated. Maintaining those social connections, even if you can't talk to others face to face. Utilize technology to stay connected with family and friends, and update them on how you and your loved ones are doing. Utilize check-in programs. There are programs that can offer caregivers telephonic check-ins to make sure they are staying connected and even getting resources that they need. And remember, take time out for yourself. The caregiver may feel guilty about taking time for themselves. However, you can still take time out of your day for yourself if you feel your situation is becoming too stressful. It's okay to walk away or go to another room for a few minutes. However, if that's not possible because your loved one needs ongoing supervision, and if you must be in the same room all the time, there are ways to be creative and focus on your own needs. Reading a book or listening to calming music with headphones are small ways to be present and available, but also separate and self-contained. And my final point, practice positive self-talk. Tell yourself, I am doing the best that I can in the situation that I am being presented with right now. So I think those are all important tips, and I want to remind our listeners one more time, *3 if you want to connect with someone to just share a comment about what you'd like to see for future presentations, or if you have a question for us. I'm seeing some really great comments and questions, and it really warms my heart that you all are sharing your stories with us, and we will follow up accordingly afterwards. But it's really important if you have some ideas or thoughts to connect with us, and because that's what this series is here for. And now, Shannon, back to you to talk about more ways of self-care.
Thanks, Kendra. Being a caregiver is a great opportunity to be able to bond with your loved one. However, during times of social distancing and being stuck indoors, caregiving can be an overwhelming job. If you don't take time for yourself, you could neglect your own health and eventually feel burned out. Now we're going to review some self-care suggestions for remaining social, even during times of social distancing. And as we all know, during this time of social distancing, this may not always be easy. However, you can still connect via telephone calls and by using technology such as video calls to stay connected. Socializing with others allows time for you to recharge and to catch up on things that relate to your life. Another suggestion is setting reasonable goals. It's not easy to watch your loved one's health decrease with time. There will be times you may want to give up or blame yourself for not helping your loved one to get better. This feeling of helplessness may cause caregiver burnout. An example of this could be if your loved one is recovering from an illness. Ask their physician about a reasonable time frame for recovery and set goals around these times. Also, it's important to remember there are some illnesses you cannot prevent, so it's vital to remain realistic. Next, creating a routine and adding structure to the day can be beneficial for you and your loved one. A routine can help you regain control over time and provide your loved one with a sense of security. If your loved one is living with a cognitive impairment, take into consideration the times of day they are cooperative or are more likely to experience sundowning. Make sleep a priority. Sleep deprivation can take a toll both physically and mentally. It may be helpful to reach out for assistance with family or professional agencies for help to care for your loved one if they have an erratic sleep schedule so that you can get uninterrupted sleep and be better equipped to manage the challenges of caregiving. Another tip for self-care is to join a support group. During this time of social distancing, many support groups are being offered virtually or over the phone. Take advantage of joining a support group to help manage the challenges of caregiving and to be able to connect with other caregivers in similar situations. We're now going to discuss some tips for keeping loved ones engaged. There are many things we can do as caregivers to assist our loved ones and things that we can do together during this time of social distancing. Keep in mind that social isolation can have a negative impact on our loved one's mental health. So here are a few examples of what can be done together to eliminate isolation and loneliness. You may want to look through old photo albums together. This is a great opportunity to reminisce. Another thought is to conduct a life review story. Write down or record important times in your life to be able to share with others. Help your loved one stay connected by using video chat to connect with others. If they don't know how, show them how to use this technology in order to be able to connect. You can show them how to use this through smartphones, laptops, or tablets to talk with other family members and friends. Encourage friends and family outside of your household to call, write notes, or send cards to lift your loved one's spirits, and call them or write them back together. And also, if family or friends are mailing letters, you may want to ask them to include pre-stamped envelopes so you're able to mail them back letters back and forth in order to keep in touch with one another. For our loved ones that are in adult care facilities and where visitation is restricted, there are still ways to stay connected. These include asking staff to use virtual technology, such as an iPad to have them connect with family virtually, sending a care package to your loved one, or you might want to record a voice message to your loved one's phone so they're able to hear your voice when needed if you might be unavailable. Another item to note is that when speaking to your loved one about COVID-19, it's important to consider the amount of information they can handle and how it will affect them. You may want to tell them just basic information and not go into so much detail in order to minimize increased anxiety. Social distancing doesn't have to mean isolation or loneliness. As you can tell from some of the suggestions that were mentioned, there are still many ways you can stay connected with your loved ones during this time.
Thank you, Shannon. Those were wonderful suggestions just to keep the connection, regardless of their medical issues or whatever care you're giving. It's important to retain that human connection during this time. So the next slide, I'm going to talk a little bit about some resources. The audio breathing exercise that we practiced today is available on our Brain Manager app. What is the Brain Manager app? Well, if you've been joining us on these calls, if you've heard us talk about it a few times, it is our new it's new for our members. It's a mobile app that can help you decrease your stress and anxiety during difficult situations or circumstances like those that have been created by the coronavirus pandemic. It teaches cognitive behavioral therapy and mindfulness techniques, and it has interactive techniques and audio exercises that you can listen to and use. And these techniques can help you create positive habits for coping, even when you aren't using the app. It is not a crisis management app. I just want to make that clear. It's pretty easy to use. I've downloaded it and used it myself. You can download it via the Apple Store or the Google Play Store. And after downloading the app, you create your own account. None of the data is shared with us or stored or sent or anything like that. It's all private. So you create your own account. So when you get to the sign-in page, you're going to choose Create an Account, enter your email address and verify it. You'll then receive an email verification code in your email inbox. Then once you click through that to verify your email, you'll ask to create a username and choose a password. And then when you're on the access code page, the access code is Calm Now. All one word together. It's CALMNOW. The email verification code is not the same as your access code. Just wanted to note that because I made that mistake myself. So there's two different access codes. It sounds sort of tedious as I talk through it on the phone here, but if you have any issues or problems, you can certainly call your concierge and they can help you as well. And Brain Manager is something you can use every day, a few times a week. It's recommended to use it 2 to 3 times a week for a period of 5 to 15 minutes. It's just based on your preference, but it definitely has some tools in there that can help. Just being present in the moment and practicing mindfulness can really help reduce your stress during this time. And I wanted to we have another poll question that I'd like to answer as we begin to wrap some things up and answer some questions. I'd like to know, after today's presentation, do you feel that you have some tips that you can use to manage caregiver stress? Press 1 for yes, press 2 for no, and if you're voting on the online forum, you'll see a new poll there that is available to vote. So after today's presentation, do you feel that you have some tips that you can use to manage caregiver stress? 1 for yes, 2 for no. And, today we wanted to make our listeners feel like you are not alone in the caregiver challenges that you face. Everyone's caregiver situations are unique and different, and that's why at UPMC Health Plan we have programs and resources that are available to you as you are a caregiver. It's something that we take very seriously, and we keep that in mind when we're putting together these programs. So I wanted to reference our website. I mentioned earlier that the presentations from all of our past Staying in Touch series and the slides are available on the following website, upmchealthplan.com/intouch, and there's a wealth of resources there. Our health coaching, how to get in touch with telephonic counseling, all of these previous talks and slides and information are available as well. If you want information about the COVID-19 virus or more information there, we have a website set up for that, and it's upmchealthplan.com/COVID-19. So we've given a wealth of information. We know you're all busy downloading the Brain Manager app, but I also wanted to mention that we at UPMC Health Plan, we offer regular powerful tools for caregiver classes for folks that are, if you're currently caring for a loved one, they're not for professional caregivers, they're for family caregivers, and they focus on the tools and resources to take care of yourself in order to thrive while caregiving. Shannon and myself, we just wrapped one up with our first virtual class. So we will be offering more of these either in person or virtually throughout the year. So stay tuned for more information from us regarding that. And I also want to take a second to promote our upcoming episode 8. It's Finding Your Strength, Recovery, and Resources. And we'll have Dr. Kara Renzelli and Dr. Jody Glantz with us. Both are medical professionals that work with us via UPMC. And they'll discuss how alcohol and other substances can impact your overall health. You'll learn about resources available to you and your loved ones, what you can do to stay strong and healthy, and how to get on a path to safe recovery. So with that being said, I wanted to highlight a few of the questions that we've had come in. Again, I thank you so much. It really does warm my heart. You know, having worked at the health plan for many years, I'm always thrilled at how well we focus on serving our members. And this series is just one additional way we're doing that. But behind the scenes, we have many departments that are ready and available to work with you regardless of your issue. And, you know, our healthcare concierge team is second to none, and they're always available. Some of you may have even heard from Miss Shannon every now and then. She does some wonderful work with our Resources for Life program. And Shannon, could you maybe comment on, a few people have asked, what are some programs that can link caregivers to resources or check-in programs? I know you have more information about those types of things.
Sure, absolutely. There are a lot of different agencies dependent really on the county in which someone resides that if you're interested in getting more information about, we can definitely get you connected with some telephonic check-in programs just to check in on you as a caregiver to see how you're doing in order to assist with hopefully providing some coping skills and ways you can manage stress and also preventing burnouts.
Great. Thank you. And I see a lot of folks are also typing in their comments for future sessions, so we really appreciate that because you know, this has been a lot of work for many and our technical team and our marketing team and all of our health professionals have really, you know, worked a lot of time to put this together, and we want to make sure that we're, you know, touching some of the topics that you'd like to hear about. And we will be continuing this. It will now be once a week. We were doing it for twice a week for the first 3 weeks. And moving forward, it's going to be every Tuesday at noon. So mark your calendars as you can join us every Tuesday at noon. And I know I try to keep this within 45 minutes. We are wrapping up some of the screenings. And for our support team, if you could put the call in music hold once we wrap up, that way we don't lose our callers that are being connected, that would be great. And Shannon, is there anything that you see on here you'd like to comment on as some final comments or wrapping things up?
Sure. I would just like to say, you know, we understand that caregiving is not an easy job. It oftentimes can be quite challenging, and that's why we're here to help support you through your caregiver role. We hope you were able to get some information and utilize some resources and other recommendations and tips that we provided for you today. And, you know, you're doing a good job. As Kendra mentioned, you're doing the best with what you have to be able to offer as a caregiver, and we truly appreciate you.
Absolutely. And for those of you who need some resources or help and you've commented in our forum today, we will be following up with you. You can expect that you'll get a call back from someone within the next 24 hours. We've been committed to making sure that happens because of the nature of some of your issues. We just, you know, as UPMC Health Plan, we are here and even more than ever committed to the health and well-being of our members. And, you know, we appreciate you joining us today, and we will look forward to having everyone with us again this coming Tuesday on May 12th. So thank you, Shannon, for joining me today. And with that, we will wrap up today's call. Thank you.